Urgent Care Project by Tamara Augustin. I propose that we build an urgent care in the city near a busy shopping center or somewhere where there's a lot of traffic coming back and forth. I want to also have an urgent care that is open for extended hours to be convenient for people who work during the day. The urgent care will offer services such as x-ray, vaccines, and urgent care needs. We can also treat conditions such as allergies, respiratory infections, skin conditions, colds, and even illnesses like influenza. The role that public policy will play, we will definitely want to look into accepting government insurance such as Medicare and Medicaid. Since the reform, there is a lot of Americans that are insured with Medicare and Medicaid. So we want to make sure that it's in compliance with CMS guidelines. We also have to be aware that market changes will affect public policies as well. Healthcare is always changing, so we will have to keep everything up to date. Regulations will have to be followed very closely to ensure patient safety, privacy, and value-based care. To justify the model, the urgent care would just be an extension to other healthcare services, which can decrease unnecessary emergency room visits. Again, the extended hours of operation will give them more opportunity to receive services. And it's basically in demand in healthcare right now, and it's very popular and very convenient and fast. So a lot of people are going to be drawn to that. The current financial data that I found on urgent care clinics is the average reimbursement is about $123, and sometimes it's even more because a lot of things are complex, so you'll be able to code the visit and then upcharge the visit. And you can also charge for having weekend services. To break even in an urgent care, it would take about 25 visits per day. But if you're open from an extended hour until 7 p.m., you may even go over 25 visits daily. And again, urgent care clinics can code their encounters to show the complex issues that patients are dealing with in receiving services at the clinic. And then that also gives us opportunity to get the most reimbursement possible. Of course, there's pros and cons to everything, but the challenges that we may come across is that we have to implement an EMR system because of regulations such as HIPAA, which is the Privacy Act for patients and patient information. Patients will come to the urgent care for their healthcare services, but sometimes the primary care provider will be excluded. And that's not the goal that we would want. So we would definitely have to make sure that follow-up is done and we get our notes and our encounters to that primary care physician so they can even reach out to the patient to follow up. And then if we don't have the right leadership, it could be detrimental. We're going to need people that know the market for us, know the competition, people that are ready to lead and to make the clinic successful. Incentives to this is patients are paying cash for their services now. A lot of people are not wanting to get insurance. They rather just pay out of pocket. So that's just cash flow right up front. Urgent cares are definitely known for being convenient, having fast services, and this is definitely important for the millennials because they're going to school, they're working, they have a lot to do, and just being open for more, at more extended hours, that would give them more time to get there and receive services. And mostly they have insurance because if they live on campus, they most likely are going to need insurance to even go to school. And then patients will choose urgent care versus emergency room department care. Emergency rooms department cares are at least $2,300 per person versus urgent care, which is about $123 to $200. And then it will take the pressure off of the primary care physicians for treating minor illnesses and injuries. The primary care physician is there just to, do their primary things, and they usually don't treat, you know, acute illnesses. But that's it for today. My references are here, and thank you for listening. Good night.